So, hi, good afternoon, everyone, and welcome to this session, which is focusing on youth mental health. Thank you, Mandy, and it's great to be here with everyone. So, I think that the main aim of today's session would be a talk about looking at our mental health, both for the youth, but I think the same would apply for adults too, which is what are some of the core ways we can increase our resilience in facing this pandemic? So hopefully that this will be a talk that inspire you to, as I said in the intro an hour ago, that may spread joy around and everyone bring everyone more happiness. And I understand that today, also being a career day, I'm asked to also say a little bit about going into the profession of psychiatry. I did a talk that was, I think, for the youth forum that's captured, that will be shared, I believe, on YouTube. So if you're really interested, I think this will be shared later on for a more extensive talk just about my journey going into psychiatry. But maybe we can just begin here talking about the profession of psychiatry. When I introduce myself as a psychiatrist, or if you think about going into the profession of psychiatry, what things come to your mind? I wonder if people can put it down in the chat. Or you can unmute yourself and give a response if you like. What things come to mind when you hear, oh, the profession of psychiatry or psychiatrist? Okay, thanks. So people put down counseling or think about both counseling and prescribing meds. And it's something about mental health. That's great. That's great. And does it make you think of this picture as well? Does this picture resonate a bell with anybody? Yeah, Mandy is saying yes. I can see the rest of you.
Yes, it does for you. Yeah, it does for me. It is very similar to a counselor setting as well. So
yes.
Maybe you could proceed to tell us what's the difference, or if that's really the case. Please, thank you.
Yeah, I remember telling a lot of people that I'm a psychiatrist. One of the first questions people might ask is, so do you really have a couch for people to lie down when they go to the office? Well, the disappointing thing is, no, I don't have that kind of couch. If I did have it, I would definitely use it for myself because it looks comfy. And this is a picture that I just grab off literally Google Images when I Google psychiatrist. And someone put down psychiatrist makes less money than even a family doctor. That's the first thing that comes to mind. But the good thing is we're a good listener, so that's good. Okay, so I think that indeed the picture of what is depicted here, it's I mean certain psychiatrists might have it, but most modern psychiatrists are unlikely going to have it. The reason there is a couch, it's indeed for a type of counseling or psychotherapy. In fact, it is the more traditional type of psychotherapy called psychoanalytic therapy, which is the type of therapy that's been used and pioneered since Sigmund Freud, who is a psychiatrist, who was a psychiatrist, I should say, and had become the father of psychoanalytic psychotherapy. And back then, and even now, this type of therapy, the model is that you can see that the patient lying down and is talking, and then the psychoanalyst or the counselor, we call psychoanalyst, is actually behind the patient. And the idea is that the patient would not be contaminated by the, let's say facial expression of the psychoanalysis, smiling or not smiling. right? And feeling judged, so they can be completely more free to speak their mind, so to speak, in terms of free associating. So that's the reason for this kind of setup. And so nowadays, psychotherapy, we do it not necessarily like this anymore unless we do psychoanalysis, but just kind of like face-to-face as we're talking right now. So this is just to show how things have changed. And there are many forms of psychotherapy, not just one type. There's this type still, but there are many other types in existence. And so it is with modern medicine too, that in the profession of certainly has grown beyond maybe previous conceived notions of what psychiatry is and can be, let's say only one type of psychotherapy, or certain types of treatment, or certain types of depiction in movies and films are not necessarily accurate anymore. And as someone has shared in the chat, modern psychiatrists, they do provide counseling and psychotherapy more often face-to-face, as well as the use of medication. And there are many kinds of modern psychiatric medications that's helpful. So getting into the profession of psychiatry does mean completing medical school, 4 years of medical school, and then specializing in psychiatry. The residency takes 5 years in Canada. It's a bit shorter in the States, 4 years, but in Canada it's 5 years. In my particular case, I also did 2 years of fellowship afterwards. So there should be, there's a lot of schooling, but in basically the last years of medical school and when you're in your residency, you're also helping out in the hospitals and clinics. So it's kind of like a co-op where you're working and learning at the same time. And so you're already both making money and also contributing back to clinics. And I would say it's a very rewarding career in psychiatry, one of the best in psychiatry specialties, I would say. Of course, all the specialties are very meaningful, and you have to find something that you're passionate about, that you love. And for me, certainly psychiatry, what I love about it is the ability to certainly chat with people, to be a good listener, as someone has said, to really understand how people think and feel and what causes suffering, and how we can work together with the client or patient so that they are able to have more experience of joy and happiness. So that's kind of the thing I do every day, and it's a wonderful experience. I think one issue that is challenging is certainly overcoming the stigma about mental illness. And even in choosing the profession or in combating narrow vision of what psychiatry is. So I started with this picture only to say and ask if there are certain preconceived notions people have about my psychiatry, which otherwise sometimes may narrow people's choices to choose this as a profession, which is great. And yes, we also do deal with learning and helping people learn, and helping people when their learning decline. At what age do our learning abilities start to decline? I think that's a good question to ask. I think that we reach our peak kind of brain development quite early on. And technically speaking, we go downhill from there, biologically speaking, on one way. But on the other hand, newer research on the resilience of the brain, if you will, the plasticity of the brain, is that you can lose massive chunks of your brain and still able to adapt. So I think that is something to keep in mind. So in terms of a learning ability, certainly people in this youth forum, whether you're here because you're youth or because you're parents, there's no need to worry about our learning ability, because as we age, technically we may lose cognitive capacity in some areas, but we often make up for it with other more mature cognitive learning strategies. And so that's something important to keep in mind, that On the one hand, we might be worried about cognitive decline if you read some reports about brain development, but with neuroplasticity, we're also able to actually learn quite effectively until you're very, very old. Now, there are conditions that impair our learning, and in that case, of course, you will need to seek treatment from psychiatrists or neurologists. And there are some cases like dementia in old age, which makes it more challenging to learn indeed. But for people without those illnesses, certainly we don't have to worry about, oh, I seem to be more forgetful when I'm older, or if you were 60 years old, it's not too late if you want to go to school and learn something new. So certainly learning is a capacity that evolves over time, and we develop more effective learning strategies. And so that's something that I would like to encourage all of us. So I think learning and facing new things is always important. So what do we need to face right now in a pandemic? Why do we need to talk about mental health? And why in this talk, it's both about, yes, choosing this as a career. It's one of the greatest career you'll be able to select, because you get to help people every day. And each person you meet is completely different, and you can really understand their story. And there's no boring day for me, because each story is unique. I think that's one of the main driving force for me, because each story is unique. Each person has a different story to tell. And you learn so much from even patients' own life story. Like right now, you're hearing different careers of people, and you really learn from them. And at the same time, you're able to kind of form alliances with them and work together to improve their mental health. So I think that's part of the joy of the career. So launching right into this, how might this talk be able to help you? Maybe we can begin there. Right now we are facing the pandemic. And so, as we talk about COVID-19 and the pandemic and the importance of mental health and the importance of helping youth in mental health, what do you think are some of the problems that you see, that you experience, or maybe you'll hear from your friends and family during this pandemic that affects our mental health? Do you want to just put it in the chat, or you can shout it out if you want? What are some of the stress we face? There's the fear of germs. So there's the anxiety about getting COVID. So this is important, because when we have fear, that can be a burden on our mental health. That's very good. Anything else other than fear of germs? Isolation. So that's very good. So that's another important point to keep in mind, is that in this pandemic, we're often separated from others because of social distancing, and that leads to isolation. There's job loss, which then would impair our finances. And certainly when our finances is impaired, that adds a lot of stress, not only stress psychologically, but also like real stress in getting food on the table and having income for housing. There's fear and anxiety about people and outdoors in COVID. There's social isolation. There's a lot of support and structures and network. There's the uncertainty, and there's constant change. And there's always a fear of bringing home COVID. So I think all this is quite important to keep in mind. I think uncertainty and constant change pretty much goes together, and that is a very important point. Thank you for bringing that out. So change, whatever change it is, even a good change, even if I say you get a promotion or something, or oftentimes when we really look at it, it is really stressful, right? So not to mention any change that is in this environment that can be negative when you're restricted. So any change is already stressful, but learning to adapt to change becomes even more challenging. The fear of endangering family members, I think, is an important one. So sometimes when we go out for whatever reasons, and sometimes we have this fear, not only for ourselves, but what if, we just bring home something, and how would we might feel a lot of guilt about that. And so I think that's another important one. And that certainly faces a lot of frontline workers, both in the healthcare and also outside healthcare. The need to adapt to new changes in protocol at schools and offices. So not only are there lots of changes as a society, but certainly at school and offices, how do you accommodate all these new things? And certainly, if we talk about youth mental health, changes in school is one of the biggest challenges we face. Perfectly agree. So if we look at all of this, it does seem like that our mental health, it's also being put under stress, even if you haven't experienced COVID. And so COVID, obviously, if you get it, and I've talked to lots of people who said it's definitely can be a challenge for some people physically, but the thing about pandemic is it affects everyone, even if you haven't gotten COVID. And so certainly I would at this point advocate everyone to do our best and do our part in terms of adhering to the social policies, try to help the pandemic and get vaccines. So if you have any fear or questions about the vaccines, certainly encourage you to express that, because I think the more people get vaccinated, the more we combat it together, the more quickly we can contain the pandemic, reverse the numbers, and have under control. And at the same time, because it does impact on all of us, we need to help each other get through the pandemic. And this includes paying attention to our mental health and well-being. So certainly with the pandemic, it comes with a lot of changes. I promote the use of face masks. If you do, of course, go visit indoor venues and things like that. So it's an important point in addition to vaccines that helps us feel protected. One thing though, from a mental health point of view, when you do wear masks, it does cut off certain amount of communication. So I think that's probably one of the things that even if we do go outside and have face masks, it does lead to that isolation and communication difficulty. So if you look at this person, what emotions do you think she is feeling? Let's have a vote here. Do you want to type in the chat what emotions is she feeling? Happy, sad, fearful? In other words, guess what emotion she's feeling. You can put an emoticon in the chat or just a few words. Okay, one person guessed happy, happy, content. Anyone feeling like fear or anxiety? One person feels sad, teary-eyed, fearful, smiling. Okay, so we've got, I really can't tell. Okay, so we've got many different kind of responses. Would say a little bit more happy or content, like 3 happy or content compared to the others. But okay, so you want me to reveal it? Okay, this is what she looked like. So I would assume that taking the mask off, do people see a difference? So I guess this is one of those things that we can understand why it can lead to more isolation and communication issues. So definitely, I would say wear a mask. And at the same time, we have to acknowledge that when we wear a mask, it does interfere with our communication. So it's even more important that we learn how to be in touch with our emotions, how do we deal with our emotions, and how to communicate our emotions. I know that we are generally, especially in the Asian culture, a little bit more reluctant to express our emotions. But I think that this reminds us that being in touch with our own emotions, knowing how to deal with it, and then the third step of being able to express it and share it, it's actually a very important piece. And this is because in this age where we are often communicating through WhatsApp or Facebook, yes, we can use emoticons. And also if we're going out and we have a mask on, yes, we can tell a little bit through our eyes. And at the same time, I think that this reminds us that we need to learn a way to communicate effectively with one another to help each other in this time. So when we talk about mental health, indeed, this is an important definition to us to keep in mind. So what is mental health? How do we take care of our mental health? So our mental health, we can look at it as the successful performance of mental activities resulting in productive activities, fulfilling relationships with others, and the ability to adapt to change and to cope with adversity. So if you look at this, it does include combating the isolation that you have already mentioned as kind of being undermined in the pandemic, as well as learning how to adapt to change, right? And then the third is being able to do something productive and meaningful. I think this is the core of how we have mental health. You can see two of those three, if not all 3 out of 3, if people are having a hard time finding jobs or they find it's more difficult to learning online, even the first highlight, like having productive activities, can be impaired. So it's no wonder that now health and also society is recognizing that it is important to pay attention to mental health for everyone during the pandemic, because these 3, being able to work and learn productively, having good relationships, and being able to adapt to this uncertainty and change, all 3 is being challenged together. But the good news is we are also human beings that are like this. So what do you see in this little diagram? Bounce back, that's right. So the good thing is, even though it seems like, oh, this is also stressful, is that all of us, we have the capacity to bounce back. We are like these little things that goes back and forth. Do you have these at home? Does anyone have this at home? It's really a lot of fun. But the idea is certainly just like a basketball, we are able to bounce back. And so even though we all encounter all these difficulties together, at the same time, we have the capacity to bounce back, and we can help each other in bouncing back. And we can develop this idea of resilience that all of us have. So scientifically, what is resilience? Well, one model that we have used in looking at resilience is to understand that all of us, as I said, we have our internal capacity for resilience. So we need to be able to unlock that key. So to tap into our inner potential for resilience. And then there's external resilience. In other words, resilience doesn't only come from yourself. It can come from all those around you. So if you are a parent, certainly your children's resilience comes partly from you, because you are the child's external environment, as well as friends and teachers and communities. This forum is an example of a community external resource, bringing all of us together through the magic of Zoom. So it's certainly, we have to pay attention to both components. And in the middle, what helps interface between internal and external are these things like our values, what we care about, coping skills, and also pursuits. What do you want to do? In other words, what do you want to become? That's the reason why you come to the youth forum. Think about future for yourself or for your kids. So all of this actually help bridges our internal to external resilience. So what are the different components? First, there are our essential needs. So these are our core essential needs. From our studies, we find that just like what people have put down in the chat, having a roof over yourself, like having food, the basic social security is the groundwork for resilience. having health and wellness, the fact that you're not having a fever right now and having, being vaccinated, those are the core to build up your internal resilience. And in the middle, it's looking at what gives you just general satisfaction about what you have and being able to feel satisfied with what you have. That's an important part of our essential needs. At the same time, we have our full potential living needs. In other words, what are the needs that will aspire you to achieve your full potential? Again, this is why we talk about this in the youth forum, in the career forum, because we all hope that you will achieve your own maximum potential. When you're choosing a career that fits you, then you're in a path towards maximizing your potential. And certainly from the external, it includes societal connectedness and feeling included. I think that's one core part of it. Internally, to build your health reserve, because if you're tired all the time, you don't have enough rest, you're just tired. You have no energy to really go that extra mile to reach for the sky. And finally, to develop growth capacity. How do we grow when there's a lot of change? So that's an important skill to have. And finally, in between the earth and the sky is the water. So this is situational needs. In other words, this is what changes depending on the circumstance you're in. And here, when we're in a pandemic, the water, in other words, how do we flow like water becomes an important skill. That includes accessing needed supports, if you have mental health kind of challenges, and internally learning how to deal with your emotions, and also working on your self-perceptions. Now, this emotional kind of resilience or psychological resilience is kind of like IQ. If you want to know what your resilience is like, you can go to this link on the right-hand bottom, and you can take a test, kind of like an IQ test. And it will be able to help you kind of almost do an IQ test on what your resilience level is like. So if you're interested in, hey, what is my resilience level like? This sounds so complicated. You can take kind of like an IQ test. And if you go to this link, it will tell you and give you a score on your resilience. And to understand and help our psychological well-being, it's helpful to kind of distinguish our thoughts, feelings, and action. So I think that is one of the important things that helps us cope with all this stuff going on, is to become aware of what we're thinking and to know what we're feeling, and then being able to take the action necessary to help ourselves. Because what we find is that our thoughts, feelings, and action influence one another. So sometimes if you are feeling down and blue, you might have depressing thoughts. And then there can be time for action. If you're doing action like being closing in, that can indeed limit our kind of scope of happiness. So to juggle and balance all of this, I know that I think our time is coming up short. I will just kind of skip to several slides to give you some ideas or some tips about how to improve our well-being. So now you understand what mental health is and what the different components, and then we break it down to thoughts and feelings and behavior. What can we do when we have a lot of distressing thoughts? And I think this is a good summary slide on how we can challenge our automatic thoughts. We can, one is ask ourselves the what if question. In other words, if you have a question, if you have stress about something, you can ask yourself, what if I'm like, if you're asking yourself like, oh my God, I might fail a test or something in the school, and that gives you a lot of stress in school, you can ask yourself, what if my friend is saying this to me? What would I tell my friend? Or what if this was 2 years ago, before the pandemic, and when I wasn't so stressed out, what would I say to myself? Or what if this is 5 years from now? what do I say to myself when the pandemic is over? I can look back and smile at what this is. And the second is observation about what is and what isn't. Sometimes we jump the gun and jump to a conclusion. So we need to distinguish what are facts and what are some of our assumptions. And finally, we can ask ourselves, what else? What else could be going on? Sometimes if we have a fear, we can say, well, what else can explain this? And so this is just kind of a general guidance about what we can do to help ourselves feel grounded. And so in addition to challenging our thoughts, it is about developing our psychological flexibility. And so it means, just like the first slide, of being flexible. So I'll just guide you through kind of a 1-minute summary of psychological flexibility. If you put your hands together like me, I can't see you, I assume you are, but if you're stuck with an unhappy thought, we can diffuse, meaning like, just look at our thoughts as just a thought. Don't let it dominate over you, but you don't need to push it away completely. You don't need to chop off your hand. You just give it some space and open up to it. This is acceptance. And you allow yourself to be centered in the present moment and say, what's here right now? Not the past, not the future, but say, what is here right now in this moment? Can I find peace in this one moment? And have a fist and a cup. If you are the cup, then you're always there to have, new coffee or new tea or new juice, right? So you're not yesterday's old news. So you can let go of what happened yesterday if something upsets you yesterday. If you cup your hands, is you can be in contact with what truly matters to you, that's your values. And if that gives you passion, whatever that might be, it could be a new career. Committed action is, what are the action steps you need to take? So this is one way of increasing our psychological flexibility. And when there's time, maybe in another session in the future, we can even go deeper into each of those 6 things. But I just wanted to leave you with kind of this idea that we can move from a place of stuckness towards a place of action. And that is important. In terms of youth mental health, there is some emerging research from sick kids that has found that over the past year, because of changes with online learning, indeed, the youth mental health has been deteriorating for some of the youths. And what they found is the more screen time you have, the more likely that children are under stress with depression or anxiety. Now, it doesn't mean that we should now stop like listening to me and turn off your screen, obviously, but from that study, it strongly advocates that there's something lost to just being on screen all day. We need to get back outside to have time to go outdoors. We need time for in-person experiences, whether it's a walk in the woods with your family or to have some outings with friends in a safe way, and minimize our time just glued to the screen, because screen can be addictive, just like a drug. Instead of addiction to crack or cocaine or harmful substances, certainly you can be just as easily addicted to the screen. So these are some of the tips to minimize just spending too much time on screen relative to real life. Screen is amazing. Virtual reality is really fun, and I love all those technologies. And at the same time, nothing beats the real world, right? I can share my best cup of tea with you, but you can't taste it. So having real world contact, I think, is important. And lastly, I think that I would be remiss if I didn't talk about how important family is, especially in this Youth Mental Health Forum. And I talk about the importance of external resilience. So families is not without challenges and difficulties. I talk with youths, and even in this pandemic, sometimes there are fights in the family. I talk from a youth where the youth would hide in the room, and obviously then being on screen all the time to try to avoid minimal contact and discussion with their parents. So while this may be comfortable, but at the same time, we just heard, just all the screen time, isolating yourself, isn't necessarily the best for mental health. And even though it can be challenging, sometimes it's good to have family conversations. I even Marvel thinks so. And if you haven't seen Shang-Chi, I'm not doing a commercial, I'm not getting paid for it, but I think that it portrays some of those family dynamics. You can still say that there are rooms to improve on in that movie from a mental health point of view, but I think it's just important for us to use this as a point of discussion for a number of things, but including the importance of family, the importance of having dialogue and working through difficulties. In this case, even challenges between what parents want our children to do and the youth picking out a career for themselves. And at the same time, I think that this highlights a certain, especially tension and challenge for us as Asian Canadians in the context of pandemic with heightened Asian stigma. It's not stigma about mental health, but Asian racism. So Asian racism in the pandemic has been heightened. And I think a lot of youths now are getting involved in movements combating Asian racism. And this development of an Asian identity, an Asian Canadian identity, if you will, is also an important part of both resilience and also this kind of coming of age, coming to your own sense of identity alongside of this having successful maturation and having a successful career. So I think that this brings out a lot of issues that we can, even discuss further if you're interested in the kind of a Q&A, the importance of family dialogue, this discussion about career and what youth wants, what family wants, our cultural traditions, and then what it's like to be a Canadian or try to be successful now that we're in Canada and we are not necessarily the dominant crowd, and anti-Asian racism is at an all-time high because of the pandemic statistically. And so the good thing is that I think just like this superhero movie shows, I think that there's also a lot of room for change because something like this isn't possible even just a little while ago. So I think with that, I will end here with my last slide, that we have a lot of difficulties, but certainly we can leap through it because like everything, things will pass. But it's also, at the same time, it's how we pass. That's the key. So how we take this journey, even though there's ups and downs, life is a journey, there's ups and downs, there are things we need to leap over, but how we do it, and we can certainly do it in style. Okay, so I will stop here.
Thank you, Dr. Fung. Thank you so much for your sharing. Sorry, everyone, that the scheduled Q&A session is a bit later than expected, but we have to thank Dr. Fung for his informative and practical tips and advice on protecting and improving our mental health during these uncertain times. So now we will move on to the Q&A session, and we've already got 2 questions from Brian. Because of time constraint, we think that we'll have to keep it to two questions from 2 people. So if anyone wants to ask a question, and please, you have to get the spot now and just type it in the chat. And may Dr. Fung please help answer Brian's question here. Actually, he asked 2 questions. So the question here we have is about a friend of Brian's, an SP, a PhD holder. He's 56 now, and it seems that his learning ability has already gone. And he always interprets what we say or write to him in a way that's different from those of ordinary or regular people. So being unable to communicate with maybe is one of the reasons why he can only teach English to junior grades. So Dr. Fung, is there anything Brian can do for him? And having a chance to help people is a blessing, don't you think so? Yeah, that's addressed to Dr. Fung. Thanks, Dr. Fung.
Sure. So I think that, first of all, Brian, a chance to help people is a blessing. I absolutely agree with you. And I think just by you asking that question shows that you are concerned about him, and that's very good. I think as a friend, I think that's a very nice thing that you are talking about, which is just reaching out and being concerned about that person. And so expressing concern is sometimes the best thing we can do. Sometimes we want to be able to fix someone else's problem. While sometimes it's possible, sometimes it might not be possible. So being a good listener, as we heard way back, being a psychiatrist is the first thing we learn is before we try to jump in and fix anything, being a good listener may be the very, very first step. And being a good listener would then enable you to both show that you really care about the situation, and then you can also hear more about the situation to find and help the person, in this case Aspie, to find the appropriate venue for help. And because there can be many reasons why someone's learning ability is decreased. At the age of 56, it's unlikely, very unlikely the person is suffering from dementia. If this has been going on for a little bit, and it can be many things, and the person is still able to teach junior grades, meaning the person still has the cognitive capacity to teach, but perhaps maybe, again, not reaching the full potential. So I think that this is a case to talk about. There could be many possibilities, right? So if we're talking about straight learning ability, people sometimes, their ability for learning can be influenced by many things. So if you were, if he was more like 65, it could be like dementia and all that, but he's 56. And if he's had this for a while, let's say he's had this for 4 or 5 years, that means maybe he struggled with this for some time. The learning comes from different places. Sometimes people have a true learning disability. So they can be really smart, but they just have a learning disability. So sometimes having a learning assessment can determine, is it is it something about the way it's that he needs to accommodate for that? The second thing could be even something like ADHD, attention deficit hyperactive disorder, which means the capacity to focus and pay attention. So ADHD is, we all hear about it. It's common in the children, and there are different types. There are people who are bouncing off the wall, is very hyperactive, like my son. Or there can be people who just simply are quiet, but just can't focus properly. And those people often do get missed. And those people sometimes are, because they are can appear as good students, they get missed. And they are sometimes very smart. So they make up for it by either memorizing a lot or using other strategies. But it doesn't mean that they don't have this ADHD. And sometimes people believe that, oh, if you grow older, you'll grow out of it. And that's true. But at least half of the people don't outgrow it. So there are adults that I see sometimes diagnosed for the first time as an adult. And they say all along, people say, why aren't you paying attention? But they realize and diagnose for the first time, this is why they have the ability to learn, is because they can't focus. So not that they have a learning disability, but a disability in attention and focus. So there are medications that help ADHD to help focus. Now, many other things impair your attention, and that also includes your emotions. So we talk about people who are anxious, people who are depressed, then they would also find for some reason they can't focus anymore. So which is why depression and anxiety can also lead to an inability to focus and to learn. So if those were the case, then being able to learn either psychologically through psychotherapy or being able to improve their attention through the use of medication, depending on what the mental health condition is, may improve the person's ability to learn. And finally, there are different learning strategies, and as well as emotional, maybe not an actual emotional disorder, but psychological roadblocks. Just like writer's block, people might also have blocks, psychological barriers. There might be techniques that they can learn to overcome it. So there are lots and lots of things I mentioned. Some of it might need a professional diagnosis, which is why it all starts from good listening and showing concern on your part, and then helping the person to sort through some of this, and the person may or may not need professional help to choose the best path. That's a long answer, Mandy.
Hello, Dr. Fung. Sorry about stopping you here. everyone, I'm sorry that we're running out of time, and there are questions that we can't answer. So Dr. Fung, if there are questions that the youth, the teenagers or young people here would like to talk to you about, how may they contact you?
Yeah, so if there are any health concerns about youth, for example, certainly there are multiple options to get help. Some people would talk to their church groups or leaders. Some people would talk to their family doctors, and that's a very good first step, because family doctors are equipped to also assess youth mental health conditions, and then also social workers. And then if you need more professional help, you can certainly get professional help like myself or other youth workers. I see youth through Hong Kong Mental Health Association. So if you're youth, for example, between the age of 16 and 18, you can certainly go to Hong Kong Mental Health Association and ask to be referred to see me. There are also child psychiatrists, if you're under 16, that you can be asked to refer to, is to see a child psychiatrist if you're a child. And there are also youth programs. If you feel like, well, I don't quite need a psychiatrist, but I want to participate in groups and youth groups that's mental health focused, you can also contact mental health, Hong Kong Mental Health Association, because we also run some youth groups that are not necessarily like psychiatrists like me, but with youth leaders that can improve your mental health without feeling like you need any diagnosis of anything. So contacting Hong Kong would also be helpful. If you're an adult, you can also contact Hong Kong or my program at the Toronto Western Hospital.
Great, thank you, Dr. Fung. So could you spell out the name of that group, please, Dr. Fung? And everyone, while Dr. Fung is spelling his association's name, please fill out the survey, the survey link that I sent out earlier. Please fill out the survey and give us some feedback about our career forum today. And I hope the information has been helpful to you, and please let us know how we could improve our Zoom meeting or other future for career-related events. Thank you so much, and you may proceed to leave this room and return to the main session now. It's the time to leave the room. Thank you so much. And Dr. Fung just sent out the link to his group, and it's Hong Kong HONG.
Yeah, the first one is for Hong Kong, as Eric put down, and that's the website, Hong Kong Mental Health Association. And then my own programs at the Toronto Western Hospital as well. But I also work at Hong Kong, and for youths, I also see 16 to 18 youths. We also have just run some groups. I'll be running another youth group for 16 to 18 in the fall. We ran one youth group in the summer, youth mental health group that I co-led with some youth mental health workers, and we'll run another one in the fall.
Okay, thank you so much, Dr. Fung, for the information.
And then you also have that, I think, link to assess your mental health resilience as well, right? I can also paste in the chat if.
Okay, thanks, Dr. Fung. Yeah, that's very helpful. And after you've copied down the information, you may proceed to return to the main room now. Thank you everyone for joining Dr. Fung's session, and thanks again, Dr. Fung, for your valuable advice and your expertise and a kind heart in sharing all of this information with our participants here. And I learned a lot from you as well. And there's a new link for
testing your resilience as part of our community project, Project Protect.
Thank you all. So bye for now. This is the end of the session.
Bye-bye.
Bye.